Hi everyone, thanks so much for tuning in. Hopefully you can hear me. I'm just going to do a quick intro before handing over to Pranesh. But can you just let me know if you can hear me in the chat or thumbs up? Yeah, good. Okay, welcome everyone. I'm sure you're probably quite familiar with with these webinars now. We've been running them pretty much every week. My name is Shoaib and I'm one of the organizers for BitePACES. And it's a pleasure to have you guys here. Thank you so much for tuning in on a Saturday. In addition to our webinars, we also run a PACES course, and this is kind of a summary of what we offer. We have a 1 day and a 4 day course. And without going into too much detail, basically, I think what we really pride ourselves on is a small group teaching. So you guys will be in pairs, and we have some really, really nice cases. Um, our courses are coming up in January and February, and we've already started selling tickets. So please do make sure you get your tickets soon before they sell out. Our early bird prices are available till Black Friday. And for the webinar attendees, you can get an additional £20 discount with this code. So please do make sure you purchase your tickets soon. Top right is a link to the website, and bottom right is a link to our WhatsApp group where we talk about our upcoming webinars and you can ask any questions that you wish. I'm getting ready to prepare the webinar schedule for December, and we have some quite exciting things planned. Here are some reviews. We've got some really nice reviews on Google. We've got over 30 now, with almost all 5-star reviews. So please do check those out. This is our webinar schedule. We're almost at the end of it for November. We've got one more next Saturday from someone who's been through BitePACES and passed. In fact, Pranesh is a faculty member and he's previously been on the course as well. So yeah, please do check that out. Without further ado, I'll hand over to Pranesh. Thank you so much for doing this, Pranesh. For those of you who don't know, he's a
Right.
renal registrar up in Manchester. He's done a lot of communication teaching for us in the past. So I think you guys will really benefit from this.
Thanks so much, Shoaib. And I swear we did not decide, and this is not a uniform for BitePACES team, but we somehow coincidentally just wearing the same color t-shirt. Good morning, good morning and good afternoon to all of you joining from various parts of the world. My name is Dr. Pranesh Jain. I'm one of the renal registrars in Manchester Royal Infirmary. I have, as Shoaib mentioned, I have been a part of BitePACES as a attendee before I did my PACES, and I'm going to be talking about communication skills for PACES today to all of you. Um, First of all, congratulations, and I'm glad so many of you are joining us today on a Saturday morning. I will um, I will not. I'll try and keep my presentation as succinct as possible. But what I would like to do, what I would like from all of you is um, communication is largely something that would benefit. Uh, I mean, a webinar would be not that useful, but it would be very, very useful if if you want to make it interactive. If somebody has done PACES or somebody's done mock and you've got any question, or if you want to, have have a run through a difficult scenario, feel free to text and then we can go through that. I have prepared some slides, so let's just go through the slides that I've prepared um, from the beginning. Okay, can you all see my slides? uh,
Yep, looks good. We
I
can.
hope. Good, perfect. Thanks, Shoaib. Right. So, communication skills itself is a very, very large topic, and I'm somebody who's very interested in talking about communication skills in general in medical practice and especially in PACES. So I have got very few slides, and it's actually a quite quite detailed, in-depth topic. So I am Dr. Pranesh Jain. Renal Registrar in Northwest. A bit of background. I am 100% sure all of you know what PACES is. It's an exam which tests you on clinical skills, knowledge, and communication skills. So communications, there is a station of communication, but in general, there's a lot of communication that would happen throughout the exam, and it will be something that you will be, just upon. Um, what I think communication is, it's a combination of soft skills, gestures, thinking about patient welfare, patient's concerns, and not just speaking, but also listening and reading, or listening and understanding the cues that the patient or the surrogate or the actor is has. We'll be mainly talking about communication today, and as most of you would know, I hope what this is. So I think communication is one of those very, very important things that is essential if we want to be successful in the PACES. PACES is a difficult exam. It's not an easy one, but it is more than exam. It's not a straightforward thing. One, two, three, four. It's it's more like a game. It's more like a game where you need to know the rules to be able to crack it. So decoding the enigma, that's what I like to call it. It is difficult, but it is a fair exam. Um, if you don't know, before the examiners go through their respective stations, and both examiners examine the patient, or they go through the scenario, and they come up with what are the things that the candidate must say or must do, and then they decide um, based on their. So if there's a cardiovascular case, both the examiners would not be cardiology consultants. They will examine the patient, and then they will think that based on what we have found, being non-cardiologists, these are the things that should definitely be picked up, and that's how they will mark it. So it is a very, very fair exam. It's practically impossible to judge you or anybody in 10 or 20 minutes how good a doctor you are, how good skills you have, including communication skills, which is why it is very important to crack the code and make sure that you tick the boxes that you're supposed to, so that you score good in all the stations. So as I say, need to understand the rules to play the game and to be successful in the game. As you all know, PACES has a carousel, it has 5 stations, and communication itself is a part of two of the stations, which is, oh, sorry, which is the one which station 1 and station 4. But you also have station 2 and station 5, where you are supposed to have a brief clinical consultation. Communication is an important part of these stations as well. Um, so yeah, so PACES, they would examine you for skills. They would not examine you for station. So these are the skills that you're assessed for: physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patient concerns, and managing patient welfare. This is all available in MRCP website. So it's a skill that they want to see. They don't want to, they're not looking at how you manage a patient with abdominal exam only or cardiovascular exam only. So it's a clinical communication. So what they want, what is the MRCP looking at? It is elicit the clinical history relevant to the patient's complaint in a systematic, thorough, fluent, and professional manner, and explain relevant clinical information in an accurate, clear, structured, comprehensive, fluent, and professional manner. I would highly encourage you to go through these, because it would really help you once you go through this. And then they also want to see how good is your judgment, clinical judgment. And this is when you speak to the examiners. This is when you speak to the patient in brief clinical consultation. And then, are you able to manage patient concerns? How well are you able to manage patient concerns? Have you made, have you attempted to understand what the patient wants to say but has not said yet? And have you made sure that um, you have answered all their queries? So these are the essential, these are the core components of communication skills in a PACES exam. Now, coming to the stations and what are the skills assessed. So, you know, A to G, and these are the stations. These are the stations and these are the skills. So, as we saw, station 1, 2, 4, and 5 are the stations where communication skill is judged. However, as we briefly discussed, in practice as well as in real life, a good communication is needed for every station, which is cognitive gesture, posture, also instructions. So a lot of times, I've seen people when they are when they come for places courses, a lot of times, also when you're so nervous and anxious, you want to instruct the patient to do a specific maneuver, but we are not able to communicate it very well. We are nervous, so we either not say the complete thing, or we're like, oh, can you do this? This is so that shows that you've not practiced very well, or you're nervous, or you are not able to communicate. But this is a very easy thing to master. So I would highly encourage you to look into that. Again, session 2 and 5. This is from MRCP website. What they say is, how candidate approaches a clinical problem in integrated manner using history, exam, and communication with the patient. So it is, I, I don't think there's any confusion in how important it is. And then communication encounter aims to assess your ability to guide and organize the interview, explain the clinical information, including you should be able to apply the clinical knowledge as well as knowledge of ethics. So this is one thing that is very important. Provide the emotional support and treat the patient with dignity and respect. So these are again core components. The last thing I want to show you is the marking scheme on a communication station. So both the candidates will have one sheet each for a candidate for a particular station, and they would have decided what are the things that you definitely need to say or elicit or demonstrate. If you manage all of the mandatory things, you would be satisfactory, which is the maximum that you can score. If not all, some, then it will be borderline. But if you've not done the important things that they thought should have been done, it would be unsatisfactory. And you would need both of them to not score you satisfactory to be in a border zone. So it is very important you understand this. This is also again very, very, it's freely available in the website. So I would not read everything, but just make sure that you've gone through this. What is important is to understand that what they've written is explain the clinical information management options in a clear, structured, comprehensive, and professional manner, and applies appropriate and accurate clinical knowledge and principles of law and ethics. So just go through this, but this is just to show what are the things. It's not a very, very difficult thing. It's a straightforward stuff if you know what they are looking for and if you know what you have to say. If you've done only this and nothing more, you still would clear, you would still pass. And before we go ahead, this is my PACES mark sheet. Not boasting, but I applied some tips and tricks, and somehow I was able to get 16 on 16 on communication skills. Thank you. And the common stuff or the common scenarios could be anything, but things that often come in exam and things that would be very useful if you would prepare is one, breaking bad news. When you break bad news, it is important. A lot of times we can forget and we forget is to offer support. You can ask them, would you like somebody to be with you? Would you like your partner to be with you when we discuss this? So this is one, offering support. You're giving them emotional support. You're offering emotional support, as well as you're giving them a warning shot. And if if not this, then you should definitely try giving any other warning shot as well. Misdiagnosis or delayed diagnosis. So this is again something that some people find it quite difficult. I had a case which in my exam, it was a difficult one that I thought. But this is again something. So what I had in my exam was that um there's a daughter who's come because her mother had a diagnosis of metastatic esophageal cancer on her second admission after 6 weeks. So she was admitted with GI problems, mainly nausea, dysphagia. She had OGD scope, which did not demonstrate anything, but was technically challenging. It was done by a endoscopy nurse specialist. They gave her some PPI and asked her to come back in 6 weeks. Before she could complete her medication, she became more unwell, had more symptoms, came back, and endoscopy this time was not possible. They did a CT scan, which showed that there was a mass in lower third of esophagus, as well as metastasis elsewhere. Now she's become very frail, very weak, and and over the weekend, the gastroenterology consultant has seen and says that this patient is too frail to have chemotherapy, which is why we would not be able to offer chemotherapy. And your job as a medical registrar on a weekend is to talk to the daughter who is angry and upset. So while I was doing all this, um, obviously the doctor was quite unhappy, had a lot of questions. And when I presented, so in my six, I had to present everything to the examiner. The examiner, the examiner asked basic questions as well as then asked, "Do you think there was a misdiagnosis?" And they dealt upon this, and then they asked if, so let's say you put her on palliative pathway, you put her on end of life care pathway, and you discharge her back home. What are the things that you would warn the patient relative about, and what are the things that you tell GP about? So this was quite a challenging one. What they wanted to hear was whether I thought it was a misdiagnosis. I felt that there was opportunity, but there was not necessarily a diagnosis that was missed, as well as even if you would have found it was quite an aggressive cancer, so it is very likely that it may have not changed the outcome. But yes, there was definitely an opportunity to detect something. And when I send the patient back home, I would tell what are the signs and symptoms to expect. You would give them some anticipatory medications. You would warn the GP about this. You would tell the GP. You would do the DNA CPR form. You tell them what are the scenarios where you'd want the patient to come to the hospital. Otherwise, everything you would want to prioritize comfort and stuff. The other thing is DVLA requirements. So among the medical ethics, it comes. So sorry. So if somebody has got seizure or somebody has got a diagnosis which makes them not drive, uh, it is their responsibility to tell the DVLA. But if they are reluctant or if they do not, then you can tell them that if you do not, then it is an obligation, and this comes in medical ethics as a part of justice to wider community for wider good. And then Mental Capacity Act versus Mental Health Act and medical ethics. Medical ethics, just a brief discussion. So autonomy, beneficence, non-maleficence, justice. These are the four medical ethics. But the other two stuff that often is a part of communication skill is duty of candor, where it is your responsibility to tell them if something wrong or something untoward has happened with the patient from the medical team, you have to disclose it. And then confidentiality. You cannot breach the confidentiality with the patient unless it is a matter of, the fourth point in medical ethics, justice. If you think somebody can be harm to wider community, you can breach confidentiality in this case. Um, One thing that I found a lot of people would do and it would help them is practice, practice, and practice. I did a lot of practice. I had a PACES course. I attended a PACES course and I had a PACES group in my hospital, which I think was super helpful. I'm sure all the hospitals in the UK have um, more than one or two candidates who are appearing for PACES. Some trust or some hospitals have a group and they have their own WhatsApp group. What they would do is they would share the patients with good signs, and then you can form a study group or study buddy, and then you can present to each other, feedback each other, and examine more and more patients. This is very, very helpful, but it's a bit tricky when it comes to communication skills or practicing communication skills. But I would still encourage you to do that. It is very, very helpful when practicing. I think having a pro forma is very helpful, and it goes a long way. I had a pro forma where what I would what so I had 6 or 7 points. It was first, after you read the scenario first. um, Utilize time very, very efficiently, access the vignette very carefully and calmly. No, do not be in rush when you're reading it. It just takes 10, 15 seconds. First, understand who you are. Are you a medical registrar in the ward? Are you a medical doctor in clinic? Are you a medical registrar in SDEC? And what is the type of scenario? Is it a breaking bad news scenario? Is it an angry patient, or is it about end of life care, or um, is it about discussing a diagnosis? What is a task? So sometimes it would be very obvious, sometimes it would not be very obvious, but you should make an effort to understand what is the exact task that you've been asked to do. Sometimes, for example, the scenario I had in my exam, the task was more than just one thing. And if you have not identified what is expected of you, you may not be able to score high marks. Then you can also understand what would be the very obvious questions or concerns. If you can find out, just find out. And then you would write, if you want to ask something based on the scenario, you may have some questions that you would want to understand. And usually it is, what do you understand? What are your ideas? What would be your concerns and expectations? It is very important to ask open-ended questions rather than leading questions. Of course, when you're running short of time towards the end and you have to cover a lot of stuff, then you can ask leading questions because you want to cover more areas. Um, ICE is a good technique. There are many other techniques, and I would not have a lot of time to do that. Spies, spikes, and there are some other mnemonics for communication skills. So ICE is a very important and it's a very, very easy thing to remember and to practice. So it stands for ideas, concerns, and expectation. So you first of all, you understand what is their understanding. You touch base and you form a basic understanding of the patient or relative. Then you explore the concerns they have, and then you understand what are their expectations. If you have formed this formally, you can even say, I just want to understand if you have any concerns, or I would like to understand if you what are your expectations out of this meeting, or after we've had a chat, what are your expectations that you would have understood. um, Active listening is an art. Basically, all I mean to say is, when you're listening to the patient or relative, make sure that you're listening actively. Your gestures would be indicative of that. Very calmly, reassuringly, without being judgmental, without confronting, in an angry patient. You have to remain calm in the, whatever. You can be sorry without being wrong. So, for example, the case that we discussed. If somebody is angry and you say, sorry, I'm so sorry you're feeling this way. I'm so sorry you had to go through all this, but I'll try my best to answer your questions and I hope this will help. So it's good to say sorry. Saying sorry doesn't mean you're wrong. So whenever you think there is a chance, a lot of times, even in real life, patient or relative, they accept something has happened. But if you say sorry, it just makes them think that you're on their own side. You're not trying to cover somebody. You're not trying to take side of somebody against them. So it's very useful. Avoid confrontation, being judgmental. So if somebody is being unreasonable, if there is a common scenario that comes, a young patient who is diabetic or a young patient who is a dialysis patient not taking their medications or not restricting to the dietary advice and has got problems, and now you're coming out of hours, 11 a.m., 11 p.m. or midnight, and they're coming. So you have to show that that you're able to be non-judgmental and take the patient and scenario without having any bias. Empathy. So empathy is it is also again a core skill. It's a core thing. You have to show empathy. If somebody is if somebody is angry, you have to be empathetic. If somebody is sad, you have to try and be in their shoes, understand what they're going through, and then help them. The other thing I think would be very useful if we go through a sample scenario. I'll go through the sample scenario with you. If there's anything that you would want to ask or you would want to know, please put it in the chat. So um, I'm sorry, the post TIA management should have been not here. But so in exam, you'll get the candidate brief part. You are a doctor in a medical clinic. Mr. Alan Fraser, a 58-year-old accountant, experienced a TIA recently and was referred to you for further assessment. He is concerned about the risk of having full stroke, so it tells you what are the concerns, and is unsure about making lifestyle changes, particularly quitting smoking. So we know the task. Your task is to explain the implications of TIA, discuss prevention strategies, and address his concerns about lifestyle changes and stroke risk. So this is not unusual to have in your exam scenario. Sometimes you'll have things mentioned very straightforwardly in your brief. So you understand you are in clinic. You've got an accountant who's had a TIA recently. So initial management was done. He was sent home and now he's referred. And the hidden points that you have to explore, which I would write in my, in my first 2 minutes, is that he is not sure about making lifestyle changes, and he's smoker. My task is explaining implications of TIA, discussing secondary prevention strategies, address the concerns about lifestyle changes and stroke risk. Now, whoever is the patient or the surrogate, they have another list of things. So they have, apart from scenario, they have, so you can see here, they have the things that they have to say, regardless whether you ask or not. There are the things that they would say only when you ask, and there are things that would tell them how to behave, to be angry, to not be angry. So it's all a scripted thing. So they have a scenario. So the thing that you see after the second paragraph is what the candidate cannot see, but the patient would see. You had a brief episode of right-sided weakness and slurred speech, but it resolved within 20 minutes. The emergency team told you had a mini stroke, and you've come today for a follow-up. You are concerned about possibility of having a stroke in the future and how it would affect your ability to work. So this is a thing which was not in the candidate brief, but is with the patient. You have been a heavy smoker for past 30 years. And while you know quitting would be good for your health, you feel like you don't have enough motivation or time to make a big change. Again, something that you have to explore and the patient knows, but you don't know. You have noticed that you have been feeling more fatigued and stressed lately. So this is a hidden concern. And you're worried about how this is impacting your overall health. Work is very busy, which contributed to the stress, and you have pressure to pay the bills. So these are the things that are there in the vignette with the patient. These are very important information for you to talk to them. And if you're able to elicit all of this during your conversation, you will score highly. What is your attitude and emotional response? It says you're anxious, blah, 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 blah. Make sure you ask the following question. So when you are there, the actor or actress, they would they would be in a patient shoe. They will be very much representative of what they've given about. And even if you don't do anything, even if you don't ask the important questions, they will still give you the information that they have to give. If you ask any question that is anywhere close to what they have to say, if you ask, they will tell you. So, for example, this is make sure you ask the following questions. Sometimes, when we say active listening, so sometimes the candidate is so stressed and is either you can be confident or overconfident. You continue to talk the whole time, and the patient is not able to ask the questions that they are supposed to ask. If for example, here it says three questions. If they're not able to ask three questions, you cannot answer all their concerns. You cannot cater to all their concerns, which then affects you negatively. And then other questions you might like to ask include this. So if you have, if you've given them time to speak, and then you've asked open questions. So for example, other questions, it says, do I need to stop smoking immediately? What are the other changes do I need to make to avoid a stroke? How will this affect my job? So these are the things that they would not ask necessarily, but it is also in their concerns. So what I normally do is, once I think I'm nearing the point where I don't have anything more to say, I would be like, uh, Alan, hi, Alan. Is there anything specific that you wanted to know? Hi, Alan. Is there anything more that you would want to know? Is there anything else that's going on your mind? Would you like to share anything else? Would you like to ask anything else? Just ask these open questions. How is the work? How is life? Do you think you've been feeling stressed? Do you think you need some help with your health? If you ask these open questions, they want to give you information. They're not trying to trick you. So if you ask open questions, they will tell you these informations. And then in terms of how they would score you, the examiners will know what are the things that you have to explore to be able to score. So these are the things in this particular case scenario. Explain TIA versus stroke, secondary prevention strategies, smoking cessation, managing lifestyle changes, reassurance about prognosis. This is something that was not very obvious initially. Work and functionality. And then if there is a scenario which includes DVLA, then you have to also speak about DVLA. If they've come with if so, for example, this is a clinic, they would definitely have come. If they're alone, they've come alone, either driving or they've taken a taxi or they've taken a public transport. So you have to ask them. So if they've come with for example, seizure and you don't think they can drive now, so you would ask them um, if they've come driving themselves. If yes, they cannot drive back. So you can ask, do you think do you think somebody can come and pick you up, or would you like me to arrange a taxi for you? And then you would tell them why you're doing this. Okay. So I'm actually at the end of my presentation. Yeah, this is just a quote. Wise men say because they have something to say, and fools because they have to say something. So make sure you are not saying things that are not needed, or things that doesn't make a lot of sense, or things that can make you as well as candidate feel uncomfortable. Thank you. This is my email address, pranesh.gen123@gmail.com. I'll be very happy if you've got any questions or concerns or queries that you would like me to answer. I'm sorry, I do not think I had enough time and that I could cover everything. Also, it would have become very monotonous if I say a lot of things, without a two-way communication. So I've kept it intentionally very, very short, so that if there was any question or if there was something to discuss, we could do that. As Shoaib mentioned initially, these are the course details and this is the discount code. Once again, I'm sure if you are in the WhatsApp group, you will get this information again. So now I'm just going to unshare and I'll give some time to you if there's a question that you would want to ask, or if there's something. Could you please re-explain the last slide about topics to tackle in the scenario? Yes, sure. Uh, Sorry, just give me a second. Okay, so here we go. Um, Thanks, Hassan, for the question. I I believe you're asking about the TIA TIA slide. So these are the things. Explaining a TIA is what explaining what TIA is versus stroke. Explaining, if you want to speak, you can just unmute and speak, Hassan. Explaining what is TIA, what is stroke risk, then secondary prevention. So in secondary prevention, emphasizing the importance of reducing stroke risk through lifestyle modification, medication, antiplatelets, statin, managing cholesterol, managing your blood pressure. If you're diabetic, managing your blood sugar, smoking cessation. So you would offer them support. You would tell them that what are the things that are in community. You can speak to your GP. Your GP will be able to give you enough support. They can give you some medications. They can ask somebody to talk to you, which will be very useful. You can talk about groups, support groups, but it's very important to emphasize that this is a critical part of his care. Managing lifestyle changes, address his concern about balancing health improvements with work, encourage him to take small, manageable steps towards the lifestyle changes, such as regular exercise, a healthy diet, a stress reduction technique, and explaining how these would improve or reduce their risk of TIA or stroke. Reassurance about prognosis, and provide reassurance that the right preventive strategies many people um, would benefit and they would have no further TIA lifelong. They can live a healthy life. They can have no stroke. They will have no stroke. Stress is importance. Stress the importance of adherence to medications, and then discuss about work and functionality, how this can affect their work in long term. Reassure him that since the symptoms have resolved quickly, the chances of long lasting effects are low. Um, yeah, I hope this helps. Uh, okay, thank you. Can you please explain in a paracetamol overdose patient who is a school teacher, does not want this overdose episode, goes into her medical record as this can impact promotion in future? The task was to convince her to talk to psych team as she is medically stable for discharge. She has agreed to that, but kept saying that same thing, that she does not want OD incident to go into her medical record and she does not want her employee to know about this. Yeah. So this again comes to the confidentiality. You can tell them that you can tell them that this is only for the medical team to look into, and it is no way going to affect. So I think what, so for example, how, sorry, Nagesh, thanks Nagesh for the question. You can see how it says she does not want her employee to know about this. So if there's a specific thing that somebody wants, what I would do is I would explore why they want this. I would say, oh yeah, sure, we can look into this. I can understand it. It's quite, it can be quite disturbing if an event like this, which is one off, and you want to get rid of this. So I would understand that she's a psychiatric patient, and she has got this. She has this social stigma, which is quite understandable. So I'd be empathetic, and I'd be saying, um, um, so and so. I can understand that it can be quite stressing, and let me reassure you, it is not going to be disclosed to your employee by any chance. This is just for the medical team to. It is just for the record of the medical team, and for your GP to know, so that they can take appropriate steps now as well as in future. And this is only going to help you, or this is only going to impact your life in a positive way in future. And then you can ask this further. Was there anything else that you were worried about? Was there anything else that makes you want this, and then you can explore this. They may come with something else, and then you have to answer to that, cater to that question. Hope that helps, Nargis. Sana, can you please explain about importance of DVLA in stroke and risk? So it is a, yeah, it is an important thing. So there are DVLA restrictions about a lot of medical conditions. And the easiest thing is to go to DVLA's website. And there are many other um, platforms where there is a list, including the books, for example, cases for PACES. So the importance of DVLA in stroke and TIA is basically you not just stroke, even seizure, somebody who's come with hypoglycemia, is to tell them that this can happen when you're driving. And if this happens when you're driving, this is going to impact your personal health definitely, but it is also going to impact the people around you. For example, you're driving in a motorway and something untoward would happen, then it would be detrimental to you as well as a lot of other people, which is why the government and DVLA have strict guidelines, which which has to be followed, and it basically means that you cannot drive for these many months. um, and if you are well for these many months, which means that if you're stable on a treatment without any more complications for these many months, then you can start to drive. So the patient has to, it's the responsibility of the patient to disclose. But if because it is an exam, if it is a patient, for example, the school teacher that we saw, who doesn't want to disclose to DVLA, they would say this. So when they indicate that they do not want to disclose this to DVLA, then as an exam candidate, what you do is you tell them that, hi, Mr. So and so, or Mr. So and so, I can understand it is quite distressing, and it can be a bit disturbing um, if if your work needs you to drive daily to work. But at the same time, it is important to understand that your health is a very important, is even more important. If you are not well to work, then there's no point in driving if you were not well to drive. Similarly, there are many other people, and it is my responsibility to ensure that, you know, health health is for all. So it is my responsibility to ensure that every step has been taken to ensure that the health of wider community is taken care of. So if you are reluctant, then I would be obliged to disclose this to DVLA myself, or the medical team will be obliged to disclose this to DVLA ourselves. So yeah, I hope this helps, Nagis. Sorry, I hope this helps, Sana. Uh, will stammer affect communication mark? I do not think so. So what happens? What would happen is, as long as you have been able to, you know, take care of those points, they would take, they would mark you. So as we saw in the, in the scenario. So for example, here, use these are the questions and these are the informations. As long as you have managed to look, the if you've explored the important scenarios, important questions, then stammering is not going to affect your performance adversely if you manage to do all that. Um, Sorry, coming back to Nugget. So our employee does not have access to our medical records. Thank you. So if you're a doctor and you are positive with, for example, hepatitis B, and you're working in an environment where, for example, as a renal registrar, I have to do procedures. So if I am hepatitis B positive, then disclosing this to my employer would be different, would not be breach of confidentiality. It would be justice to more, wider people. But if it was something that has nothing to do with people around you, then they would not disclose this to your employee or employer. But it's a very good question. I would encourage you to look into this further. I'll also look into this. Thank you for the question. Uh, okay. So yeah, does anybody have any anything to share? If somebody, how many of you had been, if you, how many of you had taken paces before? If you have taken paces before, would you like to discuss or would you like to share what was your case so that we can go through, or I can learn from you. You can tell me what you did, how you did. If not, then we'll probably call it a day. We'll close this session if there's nothing else. Yeah, breaking bad news. Death of a husband after football match. She arrived while CPR ongoing in ER and was not allowed entry. Then he died. Yeah, it's a hard one. Um, so what did the so I think what I would do is I just tell them that this has happened, and um, just the basics of breaking bad news. Give a warning shot. Ensure before you give warning shot, ensure that adequate support is available. If they're standing, ask them to sit. If they have got somebody with them, ask them if they would like them to be with you. Or um, yeah, and then give them a warning shot. Understand what they know already. What do they think is going on? What are their worries? And then you slowly build it. And I'm sure there must be something hidden. Can you share what were the questions that were asked to you? Okay, Jay, just wondering, did you use Chat GB at all? Is it Chat GPT that you mean? I did not use Chat GPT. But I guess it would be useful because a lot of these things are scripted, and um, I think it would be useful if you're good in AI apps and stuff. You can try and see if they can give you a script, So I would encourage you all to, form a pro forma of your own, just like I mentioned. So I had a pro forma for history, I had a pro forma for brief clinical consultation, I had a pro forma for communication skill, and what this would, it would be necessary things. It would include in all of them: who am I, where am I, what is the task, what are the hidden questions, what are the potential concerns, and some other basic things that I do not have with me right now, but I can share in the WhatsApp group if needed. So I would encourage you to have a pro forma and then practice with your study buddy. The more you practice, it will not come easily. You will not remember it all together just in one go. So if you just practice more and more, it will become very natural, and then you will not need to look into a book, and automatically it will be in your mind. Okay, as soon as you read the scenario, things will come to your mind. Okay, I'm in clinic. Okay, I'm a medical doctor. Okay, this is a wife of a patient who has just died. Okay, bad news. She may be angry. I would have to give her support. I have to be very, very soft, calm, empathetic. These are the things that come natural to you. And then you would also identify what are the hidden concerns, questions. You will need less time to cover more things. When you cover more things, you give patient time to speak more and more. So in one of in my in I don't remember which station, but there was a station where I think it was history, or it was brief clinical consultation. I was done with everything, and there was still some time left, a lot of time left. So I kept asking irrelevant questions. I mean, I thought it was irrelevant, but I just asked question beating around the bush, and I was like, okay, I think I've got everything that I thought I would need. Have I forgotten something, or have I not asked something that I should have asked? Or is there something else that you wanted me to ask, or is there something else that you would like me to ask? So I said something very, very vague, and then the examiners understood that, well, he's done. Why I was not in the ER? Yeah, sad and thinking we missed something because it was sudden and she was alone, no family. Examiner asked why you didn't ask the nurse to be here also with her. Yeah. So is it about support? One of the other things that just came to my mind while I was reading this. Um, so there, one of the scenarios was that a son has come with his father. His father has got a diagnosis of stroke or cancer, something, and basically, um, it is only the son who you're talking to now. And towards the consultation, he says that I feel so guilty. My father was to asking me to take him to a doctor because he was feeling unwell, or feeling this way or that way. I think it is probably my fault. If I would have been a better son, this would have not happened. So this is again, this comes to emotional support. So what was needed, or what a brilliant candidate did was, they were like, oh, I remember now. It was warfarin. It was warfarin and INR. So he was like, so the patient didn't take warfarin and had subtherapeutic INR and then had stroke. So the thing to say is, the candidate said a very, very brilliant thing is that, I'm very sorry you feel this way, and I can understand, but it's only because you love your dad. It's only because you care for him. And let me tell you something today, John or Robert or whatever. It is not that this would have not happened, absolutely, even if you've done what you think you did not do. It is possible for someone to have a stroke, even if they've had their warfarin. So this is to just alleviate their anxiety, just to make them not feel guilty. Um, And thanks for sharing, Hassan. Is there anything else or anybody else would like to share their scenario or would ask something? Okay, so if we do not have anything more to discuss or talk about now, I will call it a day. Thank you all for joining us today in for this communication skills webinar on a Saturday morning. Anybody who has been working Friday night, last night, um, well done to attend this. I'm sure you will excel. I was also working night last night, so I've got 100% empathy and sympathy with you. All right, guys, then I'm going to, yeah, thank you. Thank you all. Thank you. So I'm just going to turn off my video. All right, guys, I'm going to just call it now and turn off. All the best and have a nice day. Have a nice weekend ahead. Bye bye.